I'm Professor of Medicine at the University of Otago in Christchurch, and in addition to that I'm a consultant gastroenterologist working at Christchurch Hospital and also in private practice. Many of the people who I see in my clinical practice have gastrointestinal problems, particularly constipation, which is common. So therefore I'm always interested in new products and new treatments that are safe and effective for my patients.
What is the importance of having a healthy gut?
Well, in my opinion, the gut's really the centre of everything. I would say that being a gastroenterologist, of course, but I think it is actually true. We know that people who have a healthy gut without gut symptoms have a better quality of life. They're more productive, they sleep better, they really just achieve more in their lives. So really having a healthy, balanced gut is a very important part of overall human health.
Is there such a thing as a normal gut?
Well, it's a really good question. So I look at the gut being, how I assess the gut in a number of different ways. Firstly, a normal gut to me is someone who has no symptoms from their gut. So they don't suffer from diarrhea, from constipation, they don't suffer from abdominal pain or bloating. And if we can achieve that in patients, they're happy and they can achieve more in their lives. But on another level, there's also the whole question of what's inside the gut and is that balance correct? In our gut we have this amazing ecosystem of bacteria and other microbes which are very important to our health, but having the right balance of those is so important to a healthy normal gut as well.
How are you involved in the recent clinical trial with Actazin?
So it was a real pleasure to be involved in the trial with Anagenix and Plant and Food New Zealand, looking at the effect of Actazin on gut function. As a gastroenterologist and clinician, patients want safe, effective treatments. They don't want to be on drugs, and there's this inherent link, and patients understand it, we all do, between what we eat and how we feel in our tummy. So obviously there's this real need for patients to be able to enjoy and understand what they eat and understand the effect that could have on their gastrointestinal symptoms. So for the study I was really pleased to be involved in helping out with patient selection and looking at the protocol, also in statistical analysis and looking at the clinical relevance of some of the findings, which were very exciting.
What were some of the key findings in the clinical trial?
So it was clear that Actazin worked, that's the first thing, and the reason we know that is that the FDA have made it very clear as to how we work out whether a treatment for constipation is effective or not. And what they've done is they've said that there has to be an increase in the frequency of bowel motions by 1 per week, and that we know that in the study that we did on Actazin in this group of people that there was an increase of 1 bowel motion per week at least in both the higher dose, the 2,400 milligram dose, and also in the 600 milligram dose. So therefore this treatment is effective at increasing the frequency of bowel motions each week. And you might say, well, is 1 bowel motion a week really important? Well, actually it is, because certainly these people aren't going to the toilet often, and every increase in bowel motion that you get is associated with a significant improvement in their well-being and quality of life.
In your opinion, would these results be considered clinically significant?
Yeah, so I think in my own personal opinion I would, because I've seen the benefit that it has with patients. But in addition to that, the FDA have defined what effectiveness is, and clearly Actazin hits the mark with that. So certainly this is something that I would consider for my patients with constipation, no question.
What's the importance of regularity?
Regularity, I think, is central to our well-being. As I mentioned earlier, it all starts in the gut, and really if we can have our gut functioning well, we feel better. People who have ongoing gut symptoms often have worse performance when it comes to their ability to function normally at home, at work, concentrate, etc. So if the gut's working normally, then often many other parts of the body work normally as well. There is this thing called the gut-brain axis, for example, and we know that if the gut is causing problems, it can have an effect on the central nervous system, which may contribute to difficulties with concentration, mood, etc. So certainly getting the gut right is a good part of healthy living.
As a clinician, who would you recommend Actazin for?
So for me, Actazin as a modality is really something I'd be looking for people who have more minor, mild to moderate symptoms. People with severe constipation are probably going to need drug therapy. And drug therapy, of course, is important for those people, but not for most of the population with mild symptoms. So those with mild symptoms, those who have fewer bowel motions than they would like, or also those who perhaps want to maintain a healthy gut through the prebiotic effect of this sort of agent.
How do we know that Actazin is getting to the right part of the gut?
Actazin isn't absorbed, so because it's not absorbed, it travels through the gastrointestinal tract, arriving in the stomach, going through the small intestine, and then arriving in the colon where the prebiotics have their actual effect. And it's in the colon really that the Actazin is going to be working, and we know it's delivered there because it's not able to be broken down by enzymes that we have in our body. So because of that, it allows Actazin to get through to the part of the gut that really needs it to work.
What is the role of prebiotics such as Actazin?
So clearly this ecology in our gut is very important for not only how our gut functions, but how we function as overall as human beings. And one of the major drivers of the concentrations of different bacteria in the gut is the food that they get. And prebiotics are the food that feed the bacteria in the gut. Now, many of those bacteria may be beneficial, and you can actually augment those by either taking probiotic supplements or by using prebiotics, or perhaps even combining the two. And certainly there's a lot of thought now that potentially combining a prebiotic such as Actazin with a probiotic may lead to better outcomes for patients.